Hello, everyone, and I'm really glad that you can join us today. Thank you very much to everyone that has been able to join us from different parts of the world. My name is Paul Adepoju, and I'm the community manager for the ICFJ Pamela Howard Forum on Global Crisis Reporting. And quick background regarding the subject I'll be discussing today. So, last week, last couple of weeks, we started uh, a discussing gun violence, and today we'll be looking at this subject from the solutions point of view. So, for more than 20 years, the United States Congress included a provision in annual appropriations legislation that had a chilling effect on gun violence research. And known as the Dickey Amendment, the provision prohibits the Centers for Disease Control and Prevention and other government-funded entities from using federal funds to advocate or promote gun control. So earlier this month, we hosted a session on how to better report on gun violence. And this week, as a follow-up, I'm hosting Dr. Michael Rosenberg, who is the man who led the CDC's National Center for Injury Prevention and Control, NCIPC, during this period. The impact of lobbying on gun violence is well documented, and the aftermath has been the sidelining of science in the United States response to gun violence. At today's session, Rosenberg will be providing insights into the origin of lobbying in gun control, how he became friends with Jay Dickey, the U.S. representative from Arkansas, who pushed for the provision, and how they ended up working together to try and put science at the center of gun control. This session is highly important for journalists covering science, public health, gun violence, mental health, suicide, and other related issues. Rosenberg is a physician and public health researcher. He joined the Task Force for Global Health in 1999, retiring as president and CEO in 2016. He also served as Assistant Surgeon General and as Rear Admiral in the United States Public Health Service from 1995 to the year 2000. He has served on the faculty at Morehouse School of Medicine, Emory University School of Medicine, and the Rollins School of Public Health at Emory University. He worked at the CDC for approximately 20 years, dealing with eradication of smallpox, HIV/AIDS, and enteric diseases. He also helped oversee research on gun violence through the NCIPC that I mentioned earlier. And so we are really happy that we are able to talk to him today. And before we go into his presentation, I would like you to know that if you are joining us on Zoom or Facebook, I say thank you very much for joining us today. And we'll be glad for you to tell us where you are joining us from, and that would be really, really well appreciated. And at the end of today's session, at the end of Dr. Rosenberg's presentation, I will be providing some updates on our ongoing story contest in addition to other announcements that I have. So without much ado, I'll give the stage to Dr. Rosenberg for his presentation. Thank you.
I will just say hello to everybody who's watching and say that I want to share a perspective on gun violence because it is a horrendous problem for us in the United States. And maybe by understanding both how we got here, why it is such a problem, and how we can get out of this, maybe there will be things that will be useful for you. And I would also ask you to think about your own country and whether or not gun violence is a problem in your country. I suspect there are very few countries where it is not a problem. And in those countries where it's not a problem now, it probably will be soon. Because one thing that's been happening globally is a huge increase in the manufacture and exportation of firearms. So even if it is not a problem right now in your country, there's a good chance that it will be soon. Let's look at the next slide. And this is a poem that comes from a poet laureate of Ireland. And Michael Longley was talking about the troubles, the war between the Protestants and the Catholics that went on for 30 years in Northern Ireland. And what he wrote was, think of the children behind the coffins, look sorrow in the face, all those 30 years, the years of disgrace. Let me just say that again. Think of the children behind the coffins. Years of disgrace. This photograph is a picture at the site of one of the mass shootings in California in the United States. And you can see the outpouring of grief and sorrow and the tribute that people put here. The next slide shows you that science has helped to solve many public health problems, including smallpox and heart disease. The troubles that were talked about in the previous poem resulted in the death of 3,600 people killed over 30 years in Northern Ireland. In the US, we don't have 3,600 people killed in 30 years. We have more than 40,000 gun deaths a year now. 40,000 a year, and more than 600,000 gun deaths in the 20 years since the federal government stopped looking for a way to solve the problem in the US. 2/3 of these gun deaths here in the United States are suicides. And what you read about are probably the mass shootings and the school shootings because they get the publicity and the attention, but they are just a very small fraction of all these deaths. Even for children, school shootings represent less than 1% of the deaths of children. And most of these deaths could be prevented by using scientific research. The research will help us identify solutions that are based on evidence that are proven effective. This is the same approach that we use to reduce the deaths from motor vehicle crashes, from heart disease, from cancer, stroke, and smallpox. But in this area of gun violence in the United States, we're not doing what we could. We're not bringing the power of science to bear on this problem. Next slide. So how did we get here to this point in the United States? In 1983 was the beginning of CDC, the Center for Disease Control and Prevention, a branch of the U.S. government. It was the beginning of the violence epidemiology branch. The director of CDC said, traditionally CDC focused on infectious diseases, but infectious diseases are not what's killing the people in the United States. He said they're dying from chronic diseases. They're dying from heart disease, cancer, stroke, diabetes, and violence and injuries. And he said, we need to start looking at violence and injuries as preventable problems. And so he started the violence epidemiology branch. And I went down in 1983 to start that effort. I was the first chief of that branch. We started what we called the public health approach. And the public health approach has 3 pillars. The first is it's based on science. The science of epidemiology looks at patterns in the whole population. It's based on prevention. The public health approach looks not just what can we do to people who are already sick or who have already been shot, but how can we prevent these things from happening in the first place? And the public health approach is collaborative. Public health is not a profession. It's not a specific discipline, but it draws on many professions. Public health works with people in the law, people in criminal justice. It works with social workers. It works with anthropologists. It works with people in public policy. It works with sociologists, psychologists, architects, people who design our cities. Public health brings together many different fields to work together on a problem. So these are the three characteristics of public health. It's based on science, it's focused on prevention, and it's collaborative. This approach was applied to motor vehicle injury prevention. And the US government noticed in 1970 that too many young people were dying in motor vehicle crashes on our highways. And they said, this is unacceptable and we've got to stop it. And they said, we're going to stop it by doing research and finding out why they're dying and how we can save their lives. And starting in 1970, the US government started the National Highway Traffic Safety Administration, and they funded research at $200 million a year. And that research achieved extraordinary goals. Next slide. The research basically looked at 4 questions. It said, when we start looking at motor vehicle crashes, we're going to look at what's the problem. How many people are dying in crashes? Who are they? How old are they? Where do they die? In what kind of cars? They asked the next question, what are the causes? What was the role of drunk driving? What was the role of badly designed roads or infrastructure? What was the role of fatigue? What was the role of poorly designed cars? But what are the causes is the second question. And the third question is, what works to prevent it? Will safer cars save lives? Will better roads save lives? What works? And the only way you can find out what really works is to do it and test it and try it out, evaluate it. And the fourth question the public health approach asks is, how do you do it? Once you have something that seems to work in a small area, how do you scale it up? How do you translate your program into legislation and laws and policy? These are the 4 questions that the public health approach asks. And whatever the problem is that we're working on, we ask and answer the same 4 questions. So we looked at what had been done in motor vehicle safety starting in 1970 when the government started a big research effort. And we found out that through that work, they found out characteristics of the problem. They identified the causes, they found things that work, and they implemented these things and scaled them up. For example, they totally redesigned the car. They changed the design of the car by putting in front end impact collision protection. When I learned to drive, I learned on a little Ford, and it had an engine block that was solid. And when you crashed into the front end of another car, the engine block came into the passenger compartment and it would crush you like an anvil. You die from crush. They redesigned the front end. They redesigned the engine block so it would crush like an accordion and protect you. We had steering poles that would spear you, that would go through your chest in a front end collision. And they redesigned it to something that would collapse and protect you in a front end collision. They learned many more things about the design of the car. They developed seatbelts. They developed airbags, front airbags, side airbags, head airbags, knee airbags. They developed elevated rear stoplights, rollover protection, side impact protection. They totally redesigned the car, and they redesigned the roads. They found that what people thought were the safest roads, roads that were wide and straight and flat, were not really so good, because they found that if you design roads like an airport runway, people will drive like they're trying to take off. People will drive at 100 or 140 miles an hour and crash. They learned that the safest roads had to be curved, had to have hills and bumps and move side to side to keep people awake. So they redesigned the car, they redesigned the roadways, they redesigned the drivers, and they got drunk drivers off the roads. They tested for them and took away their licenses. These interventions in road safety resulted in the United States in the last 50 years saving more than 600,000 lives. That's a lot of lives to save. So we looked at that and said, why can't we do the same thing and save lives from gunshot injuries? And what we found was that the government was spending $200 million a year trying to answer these questions for road traffic crashes, but not spending anything to prevent deaths from gun injuries. The next slide shows what happens if we skip these questions, if we don't use science. And in the late 1960s, the pharmaceutical industry announced that they had developed a miracle drug for pregnant women. Pregnant women suffer from two main things. The first is insomnia, they cannot sleep. And the second is from nausea or morning sickness. And these are devastating side effects of pregnancy. And the pharmaceutical industry announced that they had one drug, one pill that would prevent both of these. They would prevent morning sickness and they would prevent insomnia. And they marketed this drug and they sold this drug. And it was so effective that they went to Germany. And Germany said, you can sell this drug without a prescription. You can sell this as an over-the-counter drug. And they came to the United States and they said, we want to market this drug in the United States. And they went to the Food and Drug Administration, the FDA, and they said, we have this miracle drug that we would like to market in the United States. And fortunately for our country, there was a brave woman physician, Dr. Kelsey, and she said, wait. Have you answered the questions? Do you have the data that will show that this drug is effective and that it is safe? And they said, no, we don't have the data, but look what's happening all over the world. They're selling thousands and thousands of women this drug in Europe, and people are getting relief from their symptoms. Why don't you sell it here? She said, no, you have to show us the data. You have to show us that it's safe and effective. So they went back to their business, and they came back to see her after a short time. And they said, now will you approve it? She said, do you have the data? They said, no. She said, I won't approve it. They went back and they came back 7 times. Each time she said, not until you have the scientific data to show me it's safe and effective. And when you have that come back to me, by the 7th time, evidence started to come out from Europe that this drug was causing devastating side effects. Many children were being born to women who took the drug. They were being born without arms, without legs, with deformed legs or arms, and with other serious birth defects. Many were suffering from miscarriages and not even surviving to be born. It turned out that this drug was thalidomide. And when it came out, the countries realized it. They banned the drug. But that's the risk of proceeding without having the science. You need to do the science, whether you're looking at birth defects, whether you're looking at motor vehicle injuries, or whether you're looking at gun violence. The next slide shows a man named Jay Dickey, who was my arch enemy in 1996. we had started doing the science on gun violence prevention because we saw how much it had achieved in the area of motor vehicle safety. But the National Rifle Association, a very powerful lobby in the United States, did not like the research. They told their members, and they told their politicians, and they told Jay Dickey that if you allow this research to go on, everyone, all the civilians, will lose all their guns. This wasn't true, but it was a powerful argument. And they mobilized enough politicians in the United States to stop our budget. They wanted to put an end to our research because they didn't think that this research would help them sell guns. They had attacked us for a very long time, but what finally mobilized their strong opposition was the first extramural research that we funded looked at the question, does having a gun in your home make you safer or not? The NRA and the gun manufacturers had argued for many years that if you care about the safety of your family, you will have a gun in your home, because anyone who cared would want to protect their family by having a gun. They argued that a gun in your home made your home and your family safer. So we looked at this question, we did research, we did the science, and what we found showed that not only did having a gun in your home not make your home safer, it increased the risk that someone in your home, someone in your family, would be shot and killed, not by a small amount, not by 10% or 20% or 30%, not even by 100%. It increased the risk that someone in your family would be shot and killed by 200%. The risk tripled. It's a huge increase. And the risk that someone in your family would die from suicide, gun suicide, went up by 400%. The risk increased fivefold. The NRA didn't like that because they thought that would hurt their business. It would make it harder for them to sell more guns. And they decided they would for sure put us out of business. And they got this conservative, born-again Christian congressman from rural Arkansas, Jay Dickey, to lead the charge. And at an appropriations hearing, where the director of CDC and I were testifying, Jay Dickey led the charge. It was really an ambush. It wasn't fair because they used quotes that they made up. They used statistics that they made up, and they didn't really give us a chance. But Jay Dickey convinced many Republicans, and the NRA convinced many Republicans that they needed to stop the research. The next slide shows some of what happened. There were some people in Congress who wanted to stop the research altogether. And there were other people who thought, we need more of this research. We need to stop the problem of gun violence. And what was passed was an amendment that Jay Dickey offered to our appropriations. And this is what the amendment said. None of the funds made available for injury prevention and control, that's CDC, can be used to advocate or promote gun control. It said that funds couldn't be used to advocate or promote gun control. It didn't say we couldn't do research. And in fact, we weren't advocating gun control. That would be lobbying. We were not allowed to lobby for any specific legislation. But what this was, it said that if a congressman wanted to stop the research, if you were working at a university, they could write to your dean or to your president of the university. Or if you were working in the government, they could write to the Secretary of Health and Human Services. And they could say, this person is advocating and promoting gun control, even if we weren't. And if a congressperson wrote a letter, it could take the researcher months to put together all the data that they asked for. It would interrupt the research. It would interrupt their life. and it would be a huge, huge barrier to their proceeding. So even though this didn't forbid the research, it effectively threatened people and essentially got the research to stop. Next slide. And Jay Dickey and I, as I said, started out as enemies. I think he wanted to get rid of me. He wanted to get rid of my center at CDC. I think he felt the world would be a better place if all of our research were stopped. And so he did write the Dickey Amendment. This is from a clip on The Daily Show, a comedy show here, that if you can see that link, it is worth watching. Jay Dickey and I started out totally opposed, totally opposed. He thought I was terrible, and I thought he was evil and dumb. We hardly talked. And after the appropriations hearing, my bosses at CDC said, don't you ever go back and talk to that congressman. You'll just make things worse. It'll be like pouring gasoline on a fire. Do you understand? I said, yes, sir, I understand. But about 3 weeks after the hearing, CDC got a request from Jay Dickey's legislative assistant and said the legislative assistant wanted to talk to Dr. Rosenberg about the data that I had presented at the hearing. And so my bosses at CDC said, okay, you can go, you can talk to the legislative assistant, but do not speak to the congressman. Under any circumstances, do not speak to him. Do you understand? And I said, yes, sir, I understand. I went up, I met with his legislative assistant, who was really interested in what the data showed. We had a very good talk. We met for about an hour. And at the end of our meeting, he said, oh, by the way, the congressman is in his office next door and would like to say hello to you. And I said, oh no, this is terrible. Either I refuse to talk to him and I'm rude and I make things worse, or I go and I talk to him and I go back and get fired for violating my instructions. But I thought it would be worse to be rude and not talk to him. So I went in. He said hi, I said hi. And I looked at his wall, and instead of plaques that showed how great he was, he had pictures of his children on the wall. And we started talking about his children. And then he asked me about my children. And we spent a long time talking about our families. And then the next thing I knew, he had invited my son and his whole class to come up and have a tour of Congress. And then he met with him personally, with the whole class in his office. I thought that was a very nice thing to do. And then his daughter moved to Atlanta, where I lived, and was looking for a job, and I helped her find a job. And one thing led to another. We started talking. We started to get to know each other. We started to understand each other, to listen to each other, to understand the other person's position. And soon we came to trust each other. We even came to like each other. Next slide. This next slide is another link that you might look at. About a month ago, the New York Times ran a documentary talking about Jay Dickey and me and our relationship, and how we had started as enemies and in the end came to really like each other, came to love each other and understand each other. And Jay Dickey ended up writing, the next slide will show, we ended up writing an op-ed for the Washington Post saying that we can both protect gun rights and prevent gun violence, that we couldn't do this by figuring out in our heads what would work, but if we did the research, we could find out what works. And we could find things that will keep guns out of the hands of people who shouldn't have them, while allowing law-abiding gun owners to keep their guns. And we could use science and research to find these interventions that did both of these things. And it could prove that they were effective if we did the research. Examples of these things would be universal background checks that would make a person have a waiting period before they could buy a handgun. And during that time, their records would be checked. If they had been convicted of a felony or a violent misdemeanor, if they had for some reason been prohibited from buying guns, they couldn't buy a gun at this time. That would be a way to keep guns away from people who shouldn't have them. We have laws in the United States that say people who are convicted of domestic violence misdemeanors or felonies are not allowed to have guns. We have red flag laws or extreme risk protection orders that say if someone has a gun and they are threatening to shoot themselves or to shoot someone else, then their case could be taken in front of a judge. And if a judge decides that their guns should be taken away, then police officers will remove their guns temporarily because these people present an extreme risk. These laws have now been developed in 19 of our states, and this is another way to get guns away from people who shouldn't have them without interfering with the rights of people who should be able to have them. Storing guns safely out of the reach of young children, unlocked and in a gun safe, is another way to prevent gun violence without interfering with the rights of law-abiding gun owners. I should also say that in the United States, we are limited in how we can approach gun violence. We're limited because our Second Amendment to the Constitution says that people have a right to own and use guns. This is built into our Constitution as now interpreted by our Supreme Court. Another reason why we're limited in what we can do to prevent gun violence is that we already have 400 million guns in our country and many, many people who own guns, and it's part of our culture. And finally, it's so politically polarized in our country that there are huge groups of people who stand for gun rights and others who stand for gun control. And instead of their sharing a common goal and saying we both want to save lives, all they can do is blame the other side for the problem. So we can't pass laws that remove guns from everybody's hand. That's something that's possible for some countries that don't have our unique characteristics here. But this is why we have to look for things that will take guns away from people who shouldn't have them without interfering with the rights of law-abiding gun owners. So Jay and I came to agree on this, and we said we need more research because we can find ways to both protect gun rights and to reduce gun violence. But we have to do the science. The next slide. As a result of the Dickey Amendment and the political pressure that was brought to bear on CDC, I was fired from CDC because I was the principal person advocating for bringing science to bear on gun violence prevention, for starting a scientific enterprise that was trying to figure out how we could prevent this problem. And the NRA brought so much political pressure on the director of CDC that instead of standing up for the science and protecting the science, which had been a long tradition at CDC, he decided that he would rather keep his job and stop the science and fire me. So in 1999, I was fired from CDC. And within a year, the amount of funding that CDC was spending on gun violence prevention fell by more than 90%. And for 20 years, the federal government essentially stopped funding research in this area for 20 years. Now, you might ask, if the government stopped research on cancer or heart disease or stroke, what would happen? In the United States, there would be a huge outcry by the people who suffer from heart disease or cancer or stroke, or who have family members who suffer from it. And if the research were stopped even before a day, even before it was stopped, there'd be huge protests. Why didn't this happen for gun violence prevention research? And there are two important reasons. The first is that homicides are about a third of all gun deaths, and the bulk of gun homicides are for young Black men in this country. And young Black men don't have a lot of political power. So what was happening in 1999 was that young Black men were dying at 8 to 12 times the rates for young white men. And this is outrageous and, in my mind, unacceptable. It's inequitable. And this type of health disparity is something that we should be working very hard to correct. But the research was stopped. And it was also stopped because 2/3 of all gun deaths in the United States are suicides. And those who are at highest risk of suicide are persons with mental illness, and they don't have much clout. So there's not very much of political pressure brought to bear on the government to restart the research on gun violence. And for 20 years, it was essentially stopped. The next slide. If we look at gun policy in the United States, this was a wonderful study out of the Rand Corporation by Andrew Morale. The next slide. And what he did was he looked at all different types of interventions to prevent gun violence. These are the gun policies on the left-hand side, the column that goes down. He looked at background checks, bans on the types of specific weapons like assault weapons, child access prevention laws, concealed carry laws, reporting firearm sales, licensing and permitting. But he looked at 14 different types of interventions, and he looked at the effectiveness of these interventions for 8 different types of shootings, from defensive gun use, hunting and recreation, mass shootings, suicide, violent crime, unintentional injuries. And he made a matrix, and he looked at all the evidence that we had. And he said, first, is there any type of intervention for any type of shooting where we have strong evidence that it either works or doesn't work? And what he found was that there were some boxes where there's moderate evidence, some where there's supportive evidence. You can see that's where, if you tell people they have to lock up their guns unloaded and keep them in a gun safe where children can't get access to them, there's some supportive evidence that that will reduce child suicides and unintentional deaths and injuries. Supportive evidence is the strongest for any box. You'll see there are many boxes that are blank, where we have no evidence whether this intervention works or does not. And there are some where there's limited or moderate evidence. But basically, you see that we lack evidence. There's not a single box where there's strong evidence to suggest that this intervention works for this type of shooting. Not one box. This is not only embarrassing, it's outrageous, it's deadly in our country, because we don't have the evidence on which to base the policies or the legislation. Why are we here? Again, the federal government stopped the research on gun violence, so we don't know what works. We have some supportive evidence, limited evidence, but for so many of these boxes, we have no evidence at all. If we were to restart the research, we could start to get the evidence we need to pass good policies. The next slide. Shows that in our country right now, the evidence is even more necessary, more essential. There is no one solution that's going to be a magic bullet to stop all gun violence. It's going to be incremental, very much like we found with motor vehicle injuries, where we found that we could develop front-end impact protection, add to that side impact protection, add rollover protection, add seat belts, add airbags. Step by step, year by year, we learned more, and we got better and better at keeping people alive. It's going to be the same thing for gun violence. It's going to take time. It will have to be sustained. And we have to show the skeptics that we can find things that will reduce gun violence, but also not infringe on the rights of people, law-abiding people, to own their guns. To find those things that work, we need the research. We need to be able to demonstrate it. The next slide. Although Jay Dickey and I decided that we needed to show people that we can restart the research, that we need to restart the research. Unfortunately, Jay died before we could get the research restarted. And what became clear to us is we need to be able to show that there are certain policies, universal background checks, red flag laws, safe storage, that both reduce gun violence and protect the rights of law-abiding gun owners. But if you want to show that it's going to protect their rights, you have to be able to measure how much a certain policy affects their rights. And we still need to do that. We need to develop the right scales to measure it, because what gets measured gets done. Next slide. So Jay died, but it was clear to us that we needed to get bipartisan support. We needed Republicans and Democrats, gun rights and gun control people, to come together to support this effort to go forward. We finally did get it restarted with help from Jay Dickey's former wife, Betty Dickey. We lobbied and we showed that we can find things that will do both, protect the rights of law-abiding gun owners and prevent gun violence. And we were able to get a bipartisan group to support that. And what's clear to us is that the current level of funding where it was restarted was important to get it restarted, but it's still way, way too small. We're now funding gun violence prevention research at about $25 million a year, but it's vastly inadequate. We funded motor vehicle research at over $200 million a year starting 50 years ago, and we've done that every year for 50 years. But we need to get people to work together. That's not easy. It's possible, but it's not easy. We need to form a coalition. And I think a coalition is just like a marriage. It's very easy to get into it, but it's very hard to make it work. I used to argue with some people in every group. There were people who said, marriage is not hard. I've been married for 10 years and I never argue with my partner or my wife. And I used to argue with them. I said, really? Really? That's so different from my experience. I can't believe it. And I stopped arguing. I stopped debating with them because I realized that there are some people who just lie. Next slide. I'd like to say everybody thinks they're an expert in collaboration, but Yogi Berra, a famous baseball player from my hometown, said in theory and practice are the same. In practice, they are not. In theory, coalitions and working together is easy. In practice, it is not. And just like a marriage, it takes work to make it last. It takes work to make it work. It's not easy, but it's very important. And it's the way we're going to get to the answer in the United States. The next slide. This is what we talked about in a book we wrote, where we took the lessons from collaboration that we had learned in global health. And there's basically three parts of a journey for a coalition. In the first mile, you get started. In the journey, you work on your project and you work together to achieve the last mile. The last mile is your goal. Where do you want to get to? What do you want to achieve? And it is very important in the first mile that you get clear on the last mile what your goal is. That is so important to do in the beginning, to agree on what your goal is. And the other things you need to do in the beginning are to have a strategy. How are we going to reach that goal? How will we get to the last mile? You need to have an organizational structure. It doesn't need to be a complex bureaucratic organizational chart, but it needs to say how this will work, how it will be continued, how it will run. And you need to know who's going to be part of your coalition. Who do you need in it to achieve your ends? And how are you going to manage it along the journey? Coalitions and collaboration are very important. They take an effort, but it's an effort we can learn about. It's things we can do and we can get them going. Next slide. This is a book where we talked about the lessons we learned from global health about cooperation and collaboration. It's hard, but it's possible, and it's really, really crucial. The next slide. Jay Dickey's former wife, Betty, helped us get the research restarted. And I think it's so important that we urge people in this country and probably around the world not to give up hope. This problem is solvable. If we work together, we can find the answers. We can get it done. We don't have to live with this level of gun violence in the United States. My friend, an extraordinary global health policy person named Bill Foege, said that the biggest problem we face in this country is actually not gun violence. It's not drugs. It's not partisanship. It's fatalism. It's giving up hope and coming to believe that there's nothing we can do to solve this problem of gun violence. Fatalism is our enemy, but we have a way forward. We have a way out of this. And I think it's very important. Journalists play a very, very important role in helping people avoid fatalism and pointing out that there are solutions, not just how horrible the problem is. The next slide. CDC now has a director who, for the first time since 1999, has been willing to say that gun violence is a public health problem, and it's our duty, we're committed to solving this problem. It's not a surprise, perhaps, that it's a woman who stands up to political pressure and speaks the truth and stands for a way forward based on science. Next slide. We talked about in the beginning that when I was at CDC, young Black men in this country faced a risk of gun homicide that was 8 to 12 times greater than young white men of a similar age. To me, that was a disparity that was totally, totally unacceptable. Equity needs to be one of our goals, a very high goal. In 2020, the rate for young Black men was no longer 12 times as high. It was 20 times as high as the rate for young white men. These disparities are in large part due to social, economic, and political determinants of violence and of health. There are things that we can change, We can change the fact that many young people in our country don't have access to education, don't have access to good jobs, grow up in the depths of poverty and despair and grow up hopeless. We can correct that. These are not simple or quick corrections. They take a sustained commitment and they take a strong constituency to argue for them. But again, the problems are solvable. The last slide shows a quote from a friend, a good friend, Paul Farmer, who was a remarkable champion of global health, who just died this past year. And Paul said that the source of all evil in the world is the idea that some lives are worth more than others. The source of all evil in this world is the idea that some lives are worth more than others. It's a remarkable, clear statement of a problem I think we all need to address. I've been talking about gun violence, talking about inequities and disparities, talking about the horrendous effects of poverty and racism, hopelessness, and fatalism. But I just want to thank all of you as journalists. You have the ability to help us see our way out of these problems. You can paint the problem clearly. You can let people know these are solvable problems. You can point out what we do know that will get us towards that solution. Your job is so very, very important. I thank you for what you're doing and salute you for your courage. Thanks very much.
Yes. Thank you once again for that talk. And I think you really taken what we've known before regarding this subject matter to a whole new level, taking us to the foundation, to the beginning of how the current dynamics actually came to being, the politicization, the interference of politics with science, the importance of looking at this issue from the perspective of public health. I have a couple of questions for you that I've already highlighted. Looking at the experience back then and now, um, do you think in the mainstreaming, putting science at the center, in spite of the political and media rhetorics around responding to gun violence, is it better now? And what can you see? What kind of prognosis can you see regarding science perception as true, irrespective of the political inclination, and looking at the rhetorics around the science ecosystem, around the politics, especially in the United States, and also around any rational action in response to gun violence. So, what can you say about the current dynamics of this response and this combination of issues?
It's a very good question, Paul. Let me look at it, another problem that we faced around this world for a very long time. And let's look at what science was able to do there, and that is the eradication of smallpox. This is a problem that has plagued mankind for thousands and thousands and thousands of years. People died from this horrendous disease. If you got infected, you would get these pustules all over your body. They'd be terribly painful. And basically, they would put out a horrendous stench because your body was rotting while you were still alive. It was a very, very painful, very lethal disease that plagued mankind for centuries and centuries. And finally, a vaccine was developed and a strategy was developed that would go to wherever there was a case and isolate that case and vaccinate everyone around it. And this was really achieved by the Indian people in 1980. the world was declared free of smallpox. This was a disease that had killed, just in the last century alone, in the 1900s, it killed more than 300 million people. 300 million people. And science was able to stop it. They eradicated the disease. It was basically wiped off the face of the earth by science, by knowing the truth, by using the truth, by searching for what worked and how to do it. The same basic questions that we say we need to apply to gun violence prevention. What's the problem? What are the causes? What works? And how do you do it? That one slide, that simple idea that we can ask and answer these questions can get us out of so many problems. In this country, those questions got us to a point with heart disease. We made huge reductions in heart disease, and the cardiologists have been going out of business. People are too healthy now. Same thing for cancer. We've saved millions of lives. We've prolonged millions of lives around the world. This scientific approach works. The politics sometimes interfere. Absolutely. Did they interfere in this area of gun violence? Absolutely. But did we get the research restarted? We did. And will this get us out of it? Yes, it will. Now, I think people don't understand in this country, what does science have to do with gun violence? Isn't this just a problem of the police? Don't they just have to arrest the bad people with guns who shoot other people? Isn't that the way to solve the problem? And I think people understand now what science had to do with heart disease and what science has to do with cancer. But the job of journalists now is to explain, what does science have to do with gun violence? How can we find interventions and policies that work? And so I think one of our jobs is to show what we mean by science, that we mean these four questions, answering these four questions. It means getting the information out, sharing the truth with people, telling them about the problem. One problem in this country now with journalists is that they too have been intimidated by the NRA and by many Republicans, so that when there's a mass shooting, a school shooting, or horrible domestic violence shooting, they don't ask these questions. They don't talk about the larger problem. They don't talk about what are the causes. They don't talk about where did the gun come from? What was the relationship between the shooter and the victim? What do we know about laws that might prevent this? They don't ask and answer these hard questions. What they say is, this is so terrible. This is so sad. The victims deserve our sympathy, and the perpetrators deserve to be punished. We as journalists can do better. We can ask and answer the questions. We can show there's a role for truth and science in this area.
Yes, thank you for that. If I would take you during your presentation, two part. I have a two-part question. The first part is why does it seem as if looking at gun violence through the eyes or through the lens of science or as a public health issue doesn't seem to be very, very popular instead of a social, political, and we versus them concept that it seems to be the issue now? Why do you think that has been difficult for everyone to regard gun violence as a public health issue? Then the other aspect, the other question I have for you has to do with why, if the public funding for gun violence research is not coming, what about the private sector, since they are not bound by these laws?
Let me take that second question first. The private sector in this country has helped to sustain research on gun violence prevention when there has not been federal funding. It's done some very, very good research. Philanthropy, foundations, academia, even some gun violence prevention researchers funded their own work so they could continue this. and that's important, but it hasn't been enough. The questions are critical. There are many questions we have to answer. Finding things that work is hard because you have to do controlled scientific studies, and you need enough cases, and you need to cover enough areas so you get valid results. You need big studies, epidemiological studies, but there's a lot more work we need to do, and the funding so far hasn't been adequate to move us ahead quickly. Why do people not believe in the public health approach in this country? I think there was a myth that was told, a story that was told in this country where so many people have guns and where guns are so important to many people. And the myth that was told was that if you let people do research on gun violence, if you let politicians formulate policies about guns, you will end up losing all your guns. And in a country where guns are important to many people, where it's a right enshrined in the Constitution, in the Second Amendment, this was a big threat to people. It wasn't true. But Jay Dickey believed it initially. He believed that if you let people do this research, we'll lose all our guns. We'll lose the right to have guns. It took time to convince him that you could keep your guns and keep people safe. You could keep your guns and keep your children alive at school, but we had to convince them. And there was this very large, powerful myth coming from the NRA and from a lot of politicians and legislators and lobbyists. It wasn't true. I think we've been desensitized to stories that are not true. Now people have alternative facts. There is a lot of disinformation that goes out, and it goes out at a cost. If we don't share the truth and use the truth, there's a big cost that we pay. And again, I mentioned before that gun manufacturers are increasing their sales of guns from the United States overseas, very similar to the way that was done with cigarettes. When the market for cigarettes and tobacco was closed up here in the United States, they developed very big markets overseas at great cost. And I would think that guns are coming to other countries quickly now too, as manufacturing has been ramped up. So I think the sooner that you could talk about a public health approach and let people know there are scientific solutions and that we have to answer these questions, if you can prepare people to think this way, that these 4 questions can really be very important. What's the problem? What are the causes? What works, and how do you do it? They are so simple. They are so simple. We're at risk for dismissing them as saying they're obvious. They're not obvious. They're not obvious. But if we can make people aware of things that are simple, we'll do much better.
Yeah, my second to last question, because of time, is what about insights from abroad, where um, these kind of intentional and aggressive lobbying and laws are not in place? What insights can we get from them regarding how best to tackle gun violence? And if you can also add to it, before you even mentioned the cigarette industry similarity, I was also looking at this corporate interest in gun violence to be similar to what is happening in the sugar industry too. How companies used to say that increasing encouraging people to take less would destroy the industry, the market. And so I think this seems to be an intentional, a go-to strategy for corporate entities that are directly affected by such kinds of inquiries, researches, and laws. But yet, the sugar regulatory industry, the sugar regulation is moving forward. Tobacco regulation is moving forward. So, what is special about guns that is not making the response to go as much as, in spite of the fight that the tobacco industry is having? What is peculiar about this gun industry in the U.S.? And if you can also add a question regarding similar insights from abroad where these researches are ongoing on how best to tackle this issue.
That's a lot of questions. Let me try and answer this question that I think is the most important, which is what are the insights from abroad? And I would say that for a long time and for many people in this country, they think that we have a monopoly on wisdom and good policy and intelligence, and that the way information and knowledge travels is from the United States to other countries, and that it travels from the rich North to the poorer South. Well, in truth, we can learn so much from other countries' experiences, not only in the area of gun violence, but in every area of life. Certainly in global health and public health, we have much more to learn from other countries' experience than we have to teach. And again, for a long time, people thought, oh, we know how to do healthcare in this country, and we should ship our model overseas and we should teach them how to do it. It turns out that we spend the most on healthcare per person in this country, but we rank 24th or 25th in terms of the quality and outcomes of our healthcare. We have a lot to learn from other countries. And a lot of times, poverty is a great stimulus for innovation. And so, people in poorer countries may be thinking smarter and doing better than we are. We have a lot to learn. In the area of gun violence, we have a lot to learn from countries that have been more effective in controlling the problem, countries who are able to limit access to guns and are not restricted in the types of interventions that they can develop. We have to work with the situation that prevails in this country. Many other countries aren't yet burdened by an overwhelming number of guns, by strict polarization, by strong lobbies for guns. And they've done really, really well. They've done much better than we have. We have a lot to learn, not just about gun violence prevention, but about so many areas, certainly in the areas I've worked in, health and global health. I hope this is helpful, Paul.
Yes.
I need to run to go take care of my family and do
Okay.
other things.
Yes. So, thank you very much, Dr. Rosenberg, for your insights today, and we really do appreciate everything that you've shared with us. And so, for everybody in attendance, I know you found this session to be quite useful. But before I go, I'd like to share some information with you regarding, I know you may have questions. So please and please, if you have questions, I would gladly pass these questions on to Dr. Rosenberg. And if you would also like to have the slides for this presentation, please and please just send me an email with the email address you are looking at on your screen right now. I would also like you to share your thoughts about this session, and I really enjoy hearing feedbacks from our participants. So please and please, if you want the slides, reach out to me via this email and I will reply immediately with the slides. But in that slide, let me know your thoughts on this session, and we take things from there. I also have some information regarding our ongoing story contest, and so the topics that are eligible for this contest this month includes gun violence, different topics under gun violence, suicide, mental health, mass shootings, and others. HIV/AIDS also qualifies to be entered, and if you've done any story on monkeypox, you can also submit those stories for the competition, in addition to COVID-19. Even if you have other stories that were not listed there but have been covered in our webinars, or you either way utilized any resource from the ICFJ forum, we are glad to also consider that for this. And the deadline for submission is August 30th, and the announcement of the winner would be on September 1st during our webinar on that day. And for you to submit, that is the link that you have to participate. So I want to thank you very much for joining us today. Reach out to access our resources on www.icfj.org. You can also check out more resources on IGNet's website by visiting www.ignet.org. So I'll be back with you same time next week or next week at a different time. I think for another interesting discussion with a well-reputable expert on this subject. So thank you very much, everyone, and enjoy the rest of your day.